Hi, I'm Dr. Erin Ducat with Ducat Chiropractic and Sports Medicine here in Bloomingdale. Today, I'm going to share with you guys some of the new assessment that I'm doing with all of my patients on their wellness visits. The point of a wellness or maintenance visit is to come into the chiropractor when you may not be having symptoms and make sure that your body's moving well. Because when you move well, you're going to feel better and you're going to function better. So I don't want to wait and rely on my patients telling me when they have symptoms when they come in to know where to adjust. I want to be able to tell areas of their body that may not be moving as well and be able to adjust or stretch or do whatever we can to help those areas move better so that they never develop symptoms in the first place. So Steve was willing to be our volunteer model today, and I'm going to take him through the screening test that I'm taking all of my wellness patients through on each visit here in 2019. So Steve, whenever you're doing any of these movements, if you have any pain, please let me know. So we're going to have you put your feet together. And then we're going to start with your neck area. So just try touching your chin to your chest and then look all the way up towards the ceiling. Great, you can come back to normal and then rotate as far as you can to the right and then as far as you can to the left. All right, and then next I'm going to have you try touching your fingers behind your back. All right, let's take a look here. He's got about 4 inches in between his two hands there. You can see that this right shoulder is pretty tight. Try the other side. We had a couple of pops there, if you guys couldn't hear that in the video. And this one's about 4 inches apart too. Now if you notice, his left shoulder looked a lot better on that side, but this right shoulder was still pretty tight. So I already know that as we're adjusting him today, we're going to be working on that right shoulder. So next, we're going to have you bend forward, try to touch your toes. All right, and actually he does really well at this test. Nice spinal curve, made it all the way down. Then we're going to have him go back into extension as far as he can go. And I'm just checking his spine here to see if there's any stuck spots, and I find a stuck spot right there in the middle of his back, so I know to adjust there today. Next, I'm going to have you put your hands by your side and then rotate as far as you can one way. Now his back shoulder should clear the front shoulder. You guys can see there in the video, he doesn't quite make it. And then the other side. All right, this one's a little bit more flexible. Now just because I'm used to watching people day in, day out, I can tell that right here is kind of the juxta of his problem, his issue that we're going to be doing a lot of adjusting on today. The last test is to stand on one leg. Bring your leg all the way up to 90 degrees. So we're looking at his balance, his ankle, his leg function, and then the other side. All right. Now I know he looks pretty, well, maybe a little steady up here, but down below I can see his foot shaking back and forth. So we know we're going to be doing some foot adjusting. So Steve, do you have any pain or active complaints?
Not today.
Today? So this is a patient that doesn't have any pain, doesn't have any complaints, but definitely has areas of his body that aren't moving well. So if we can get those areas moving better before he has symptoms, he's going to have a much better outcome for the long run and be able to perform better and feel better for years to come. So on your next wellness visit, this is the process we're going to be going through. And if you maybe haven't been here for a while for a wellness visit and you feel like this is a process that maybe you should be going through, give us a call or schedule your next visit online. We'd be happy to help.